the other bad things we have amongst Indians is our good cholesterol is low, genetically. Many of you have like, normally it's 45, at least the males, by the way, the females, they have a higher, or there could be 65, 70 or more. But the males, is 45, and many of you, I can bet you, is less than 40. Okay, less than 40, even lower. And itself, the low, high cholesterol, decreased high cholesterol, HDL, decrease itself can be a risk factor by itself. LDL may be normal, but if your HDL is very low, then you have a chance of having the problem. And of course, insulin levels. So anyway, I'm sorry. The other thing is that exercise is much more important. Exercise is not only reducing the heart attack or brain attack, but you also have breast and cancer and other areas. So basic thing is that from today onward, every one of you going to do 3 days regular exercise training. Do good time, at least an hour, for half an hour for sure. Walk 4 or 5 miles, brisk walking, not karame wali walking, just walking that. And reduce your stress level, okay? Reduce your stress level. Now I finished the heart attack part. The next thing is the brain attack. It's the same, principle is the same, because the same high cholesterol, HDL, LDL causes occlusion of your coronary arteries, but also affects the arteries in your brain. Your brain is supplied by 4 arteries. I have a picture later on, but there are 2 arteries going this way, called carotid, internal carotid, and they got 2 in the back. It's called vertebral arteries, and they form in the brain, the vertebral arteries, they join, become one, it's called vascular artery, and then internal carotid, they go inside here, and they give up through the eye, 1 branch, and then goes to the brain, 3 branches, and the back part gives, like 4 branches. There are many other, anatomical things. So coming back to here, this is the 3rd leading cause of death amongst Americans. This is not Indian, but American, in America. Okay, 150 deaths per year in US, 750,000 new symptomatic stroke a year in US, 11 million new SM, just like you are having heart attack, you have the same chance of getting brain attack or stroke, and you are not recognizing it.
What is the difference between symptomatic and asymptomatic?
Asymptomatic, you don't have any symptoms. Okay, you're not having any problem. Symptomatic is somebody saying, oh, I'm feeling my numbness on my right side, and it's kind of came and gone, and then you're getting again and again, means you are doing what's called, a warning sign. It's called TIA, transient ischemic attack, which is symptomatic. Okay, so again, this is leading cause of disability, and it can be prevented. Now look at here, the stroke itself is 45 3 billion per year. It's not just, so basic thing is that how the heart attack can be lethal and you are gone. Okay, the stroke, I know, but that's less expensive than this one. So if you got a brain attack, if you are paralyzed on the right side or left side, and then you can be fed, you are not eating well, so all this stuff over here, loss of productivity, drugs, physician fee, etc. So this is a nursing home. People end up in nursing home. 53% of the whole total, $45 or $44 billion a year. Okay. Problem is that we have more data available about the heart attack amongst Indians, but there is not as much data available, and we're trying to do something of that. Basically, like available coronary artery disease in the Indian Asian have higher incidence of stroke in North America, according to the our study, but it's not as it was done. CADI was, study done by API, and we were involved in that. Have higher incidence of coronary artery disease. Stroke also is higher, but you don't have that much number as we saw. I showed you about the Kaiser data and that data, so it's not as good. What are these etiological factors? It's the same thing, so I'm not going to repeat. Diabetes, the metabolic syndrome, insulin resistance, hypertension, diet, and hypercholesteremia, smoking, etc., etc. Okay. There are some data on Asian Indian. This study done again in the UK, just for highest in Bangladeshis, less than even Indian. So Bangladeshis, but again, that's UK studies. Diabetes amongst Indian in Malaysia is higher than any other population. Okay, and again associated with this stroke. Have that again insulin resistance and pre-diabetic state I mentioned to you. They have it here too. So the study from India is lacking. I mean, there are a lot of hospitals, there are private hospitals, and on, Apollo, like Fortis, everybody. But they are all interested in making money. Okay, the universities, hospitals, many of them, they are so busy seeing patients with the Maulana Azad All India Institute. The real statistical, epidemiological research, which you do by research population survey, you like it. That's one of the bad things about it. And so there is, there's one study done again by Nadir Barucha and from Bombay Hospital, and they found that the incidence prevalence in Parsi community is similar to the US. The Parsis are very good in that. They do their Bombay studies. But the Keralites and Gujaratis in Bombay, they have highest stroke incidence. And the one other thing what happens, that here I was telling you, so this is one of the carotid artery here going in your neck, and going into the eye, supplying to the eye here. So sometimes you may have mono, in your eye, one eye, left or right, depends on which side you have. You might kind of can't see anything for a short period. Then you get better, and you have a few times. So that's another warning sign. And then this artery goes to here. This is one supply, goes like this. Supply this area, it's called middle cerebral. And there's one branch which is supplied in the middle part of this called anterior cerebral. And then you have the other artery which is not given, maybe next slide here, supply the back part of the head, called vertebrobasilar system. So there are the two systems. Now see here, this is again the picture. So here we've got intra carotid going this way. This is middle cerebral. This is going anterior cerebral. And these are the, so here the other one I was telling you, this is the posterior circulation. You're getting two arteries becoming one, and these are the different branches. But the God has really done nice way, because there is called circle of Willis. So let's say if you occluded one of the areas somehow, but there are some way you could be able to get the perfusion. So therefore, a lot of times we see patients who have complete occlusion upon the internal carotid artery, nothing, no blood flow, but they don't have any symptoms. Because they are asymptomatic in the sense because the other side has taken over. The other part amongst Indians, we don't get the big large vessels problem, like this artery big one, but they get small vessels, small vessels. The same thing Afro-Americans, like not the major artery, which I showed to you. Okay, so basically based on this, you have called, like two kinds, like you have thrombotic stroke, which means the cholesterol forming here in the neck and throwing it. The other thing which you have from the heart. Remember, you have some people who have atrial fibrillation, and therefore you get the collections of the clots in the heart, and it's called embolic. And the other thing, of course, is sometimes you have hemorrhage. It's bleeding. Like see, Dikshitji, just give an example. Like Dikshitji had this. Thrombotic stroke. R.D. Dikshit and many of you are involved. I was talking to every day. We were able to. So basic thing is that, like thrombotic, embolic, and the hemorrhagic means there are some bleeding in the brain. And the factors are, many, these are the other things, anticoagulants. If there's somebody in the early age, then in addition to this cholesterol type problems, you need to see if there's some like homocystinemia, lupus anticoagulant, protein C. But this is again, like before age 50, we always do. So this is again what I was telling you, that you develop this premonitory symptoms. Means you get eye problem, then you felt like eye numbness, tingling, and then you felt right eye transient blindness. Then you notice that numbness or tingling on the other side. Remember, the brain, the right brain represents the left body, the left brain represents the right body. So therefore, if you got the right eye problem, they also have the symptoms on the left side of your body, opposite. And therefore, if you have the symptoms, let's say that, don't forget about it. Okay? 30 days post TIA, there are 3 out of 10 will have a stroke. 1 year, 5 out of 14. 5 years, 25 out of 40 will have, like post-TIA stroke. So that you need to get checked out. If you have recurrent stroke, post-stroke interval 30 days, strongest predictor is large artery atherosclerosis. So you get MRI, MRA, and make sure that all the other tests has been done. Other things I already talked to you, hypertension, blood, age, too, is another factor. So what can you do? Now, again, the same thing. You can't become younger if you're old. You can't change your gender. You can't change your race and heredity. But these are the modifiable things which I have already said to you before with the heart attack. Okay, smoking, heavy alcohol use, having a glass of wine or a glass of scotch. No, I'm just telling you. No, this is the number. No, just listen here. The point here is that what I'm dragging it over here, that there are a lot of changes you have to make. Okay, not saying about your drinking, but they have been shown that particularly people that you have low HDL, the good cholesterol, which is low, there are only 4 things which you can improve. One is exercise. The second one is diet. The third one you could be able to get like niacin, which is another thing. And the fourth one is, Crestor or some kind of statin drugs, Lipitor, etc. But it's been shown this incidence of your good cholesterol, increasing it, alcohol. And I'm not trying to say you guys start drinking. That's not my point here. But the point is that it has been shown that drinking a glass of wine, a beer, or one scotch, 1 ounce of, 3 ounces of scotch, excuse me. One peg. Doesn't really matter. You see a lot of things in my literature that, wine, red wine is the one which, that's not the case. Okay, although there was a study done by the wine company, okay, from Napa Valley, they said that yes, there is a difference. So anyway, but what has been done, it's the same. But I'm not trying to tell you. Okay, the other thing is that, another thing which we already talked about, if you drink too much, then you have that negates the fact, same thing. You have higher incidence again if you're drinking 5 or 6, like martini a day or 4 martinis a day. You have the same incidence of having heart attack and brain attacks and liver problem and everything else. So again, we already talked about the blood pressure things over here is the most important. You need to have, now the important point is somebody had developed a stroke, you need to not drop the blood pressure rapidly. Then you need to really keep the blood pressure a little bit higher so the blood is perfusing, the brain is being perfused properly. And so you need to control that, blood pressure again. And we already talked about the diet, many same way. Like basically using the vegetarian diet, associated 6% lower risk of stroke. And that fish may reduce. Fish, okay? तो बंगाली ब्राह्मण जो है ना, बंगाली ब्राह्मण लोग जो हैं, यहाँ पर कहाँ है हमारा दुबे, अजय दुबे, यहाँ नीचे यहाँ, sorry, I'm not looking at the light. Anyway, fish. Fish is good. Now I talk about alcohol. Okay. Exercise. Said enough. Smoking, forget it. So here are the things. The studies by, if you do stroke risk reduction, placebo versus active, see those people, there was statistically significant difference. That's what I mean about what I'm showing you here. This is a well-designed, double-blind controlled study. Okay, that's what is important. Okay, so what do you do? Okay, so basically these are 3 things you do in a patient who has developed a stroke or having TIA. One is cholesterol high statin drugs, niacin. Number 2, blood pressure medicine. Number 3, your diet, etc., exercise. Number 4, antiplatelets. This once you have had the same thing, of course, like for the heart too, and I didn't go into the medication part of the heart disease. But again, this one is called is the aspirin. And the best thing is for every one of you, unless until contraindicated, you take a baby aspirin. Not the whole 365 milligram. Taking a baby aspirin a day can be of some help. So this is a baby aspirin. These are the other drugs, like this called clopidogrel, and this one here is dipyridinol, and these are the other two drugs, prescription drugs can be given, but aspirin is still good. So 60 to 300, baby aspirin is the one, okay? This one here, the clopidogrel, and they've been shown that, clopidogrel can decrease, but again, it's prescription medicine. And I'm not saying anything that you don't take it just for, prevention by itself. If you have some problem, you can be able to take it. This one here, dipyridinol and aspirin, is agonized. Okay, and this is given 75 milligrams. This one here, like BID dosage, which we use. And aspirin, of course, is we normally. So basically, statin, which is all the Lipitor, straight, like Crestor, and all of them, definitely they have been shown to decrease the incidence of further. Once you have a stroke, they cannot open it up. But then there's a further secondary stroke prevention is more important, and therefore, the heart, protection study, which we already talked about, and total cholesterol. Now this is an acute problem. Some of them acute stroke. It's called TPA. This is immediate, but you have to reach there within 4 hours, 3 to 4 hours in the hospital emergency room right away, and they can be able to give intravenous this particular compound is called TPA. And there's a big study, which had done. Now the other thing too, you do the medical versus surgical. Sometimes if you happen to have this carotid artery, which is going here, occluded. I mean, it's 100% occluded, you can't do anything. But if you got 60% occlusion, then they can be able to go and operate, take it out. Now, again, you got to think about other factors, but that's doable. So again, basically, NASCAR is another severe stenosis, medical, because these people are very bad, they can't do the surgical. So therefore, like 99% surgical, 20%. And again, moderate stenosis, medical still good, but this is better because they can operate for moderate. So less than 60%, you can do it. If you got 80%, 90%, you can do it. Now the other thing too is symptomatic. When I was telling to you that you don't have any symptoms, you may have a little bit tingling, numbness here. I don't want guys to get scared that like you have developing a stroke, but if you have persistent one side of the body, then start thinking about, and these are asymptomatic. And we found that like people to do the study, they have some minor symptoms, they have risk factors, doing MRA. And brain, MRI you all get, MRA means looking at the blood vessels in your neck, in your head, can be of some help. Patient education is very important, and I already talked to you guys more than what you need to do. So, coming back to the summary, heart attack is very common among cases. Stroke is the third leading cause of death. It's also high, I can tell you that, but I don't have enough data to tell you that stroke is good in the trial. But it needs to be done. Again, stroke and heart attack, or stroke means brain attack. The preventable and treatable incidence is very high amongst us, and we need to start thinking about ourselves. What can we do? So therefore, for this treatable, preventable disease, genetic factors are there with us, but our diet, our other factors, metabolic syndrome, which I mentioned to you, that's a correctable that you can be able to change if you take vow that I am going to lose my belly, my jelly belly is going to be decreased. Number two, my blood pressure is going to be decreased. My cholesterol level is going to be down. From today onward, I'm not going to eat mithai. Big time mithai. Not one mithai you can have, but if you're having 4 or 5 mithais,
One a day.
I think we can reduce from this kind of conversation.
तिवारी जी कहाँ गए?
One a day, one a
All
day.
right, you can have one glass of wine, and maybe less carbohydrate. Maybe you can have a protein. I don't care what kind of protein you eat. Fish is good. Fish become Bengali Brahman. Ajay can tell you.
I'm telling next time we'll have fish.
Yeah.
Shakahari fish. Shakahari fish.
So
What do you call
again,
those fish? Where the कहाँ से आते हैं? Fish कहाँ से आती है?
so again.
उसको क्या बोलते हैं? Seafood. You can see it, you can eat it.
No,
All right, guys, don't fight. Okay, so I just say to my friend, my Brahmin friends, please take this thing serious. I'll tell you 1 second. Take this one seriously.
वाजपेयी जी को बोल रहे हैं।
तो रात की कुल्फी कैंसिल कर दें?
करते हैं।
हाँ, कर दो, कुर्सी। हाँ जी।
आज ही चला कल से।
एक मिनट, one person यार। तो नहीं ना, पंडित जी के बारे में मत कहो आप सब लोग। हम उनको कहते हैं, हम उनके छोटे भाई हैं।
उनकी कैंसिल कर दो, हमारे नहीं, इनकी दे दो हमको।
नहीं, दिन में कहा, रात की नहीं कहा। दिन में
एक मिनट, one person.
My question is, if someone is going through a stroke, waiting for a view, other than calling 911, there's some immediate action, like a heart attack, you can do something. Is there any advice immediately?
Well, you can't do anything on a heart attack either, because if somebody not breathing, you can do CPR. The same thing here, the most important thing is that this person need to be transported ASAP to the emergency, a good place where they have, like big stroke as well as cardiac care immediately. Remember I told you that 3 hours, 4 hours now, it's usually 3 hours. If it's less than 3 hours, if it's transported to place, they can do TPA, that's intravenous injection. It blocks, the removes of the blood. There are many places they have also not available, like we have at UCLA and USC. It's called MARCI device, which what they do, they go through an artery and they try to retrieve the clot. The clot is sitting here in your brain, in this artery, the one I showed you a picture. They can go through there and they can be able to retrieve the clot. But they are only available certain places, not available everywhere. But the thing is that for stroke, identify all of you if there's any problem. The next thing is somebody having stroke, immediately call 911. And there is one study is going on, by the way, which we are doing magnesium. Just giving magnesium, like injection to the patients. It's not completed yet, but we're doing that study at this point. All right, Ajay, you had a
I
question.
think if there is a heart attack, you can do the coughing.
What?
You have to cough.
I know, but that's not one. Yeah,
I
that's.
read in the book.
I know, but yeah, I know, but the problem is that.
Patient is already balanced.
Yeah, I don't want to really. There is